investors actually were not very optimistic about the healthcare sector because, as you said, I mean, it was a low ROCE kind of a business, and people were almost on the verge of giving up on the sector till Max happened. What would you say is the true or potential return on capital employed of the hospital's business? I mean, you're running close to 30% today on that. Do you think it's sustainable over a period of time, but the kind of margin profile and the return profile that you've been exhibiting?
My belief is as hospitals mature, with the advent of and this huge digital revolution which is happening, at the very least it is going to allow us to and enable us to reach out to more and more people, more effectively and efficiently, which essentially for a quaternary care or tertiary care hospital like ours, what it does, it helps us to reach more people and convert more people. Then you've got this whole digital revolution which is happening, which is quite phenomenal. This entire proliferation of insurance which is happening, which is quite phenomenal as well. This segment for us has grown by 26 or 27% over the last 1 year. Coupled with the fact that, at present we've got, the international medical tourism, which has not been sort of come back to its full potential because of the strict travel restrictions to the country that we've had. That is something which should solve itself over the next, in the short to medium term. And, that should provide you further sort of margins to the bottom line. Now, I mean, you do keep in mind that, most hospitals and all hospital chains have been going through a period of serving COVID patients in lieu of the usual elective surgeries. And most COVID patients come under price capping. So our EBITDA per bed, our ARPOB for COVID patients, etc., are a lot more subdued than what it is for our usual elective and tertiary care surgeries.
What are you doing which is different from what other chains are doing? You talk about this kind of return ratios, this kind of occupancy levels, EBITDA per bed. What is Max doing which is different from, say, what a Fortis or an Apollo is trying to do?
So I think first and foremost, we are very blessed that we have a majority of, or we have a significantly higher amount of beds for us are located within the metros. Now what happens, and even when we're expanding going forward, we're adding locations, a tremendous amount of locations within metros, simply because, within our network of hospitals, we have these land banks which are available. What that does is, whilst across the country, as you are aware, there is a shortage of specialists, right? Be it for oncology or any other sort of clinical treatments, the ratio, there's huge shortage of specialists like there is for most professionals across the country. But, that's not the problem in metros. You do have the best professionals, the best clinicians, etc., who live within these metros simply because the social infrastructure is there, the schools and colleges for their children are there, and so on and so forth. That allows us to and enables us to focus on more tertiary care and more specialty. So, if you actually see, we have 85% of our total capacity right now within the metros of Delhi and Bombay, whilst our closest competitor would have about 70% of the capacity. We have about 53 to 54% of our business which comes through surgical revenues and the balance through medical revenues. But I think, if you look at most of our competitors, it's about, I think, 37 to 38% of business which comes from surgical revenues. Now, if you actually look at the amount of critical care beds, again, that is demonstrative of the fact how many surgeries you do. 30+% of our total beds are critical care beds, ICU beds. Vis-a-vis, I think for others, it's about 21-22%. So what that essentially says is that, look, we are doing a lot more tertiary care. We're doing a lot more surgeries. We are able to do that because not only infrastructure, but we also have 4,600 senior clinicians. Most of them who work for us on an exclusive basis, and which heavily focused on high-end tertiary care and specialty surgeries. And we're able to do it, like I said, because we are based out of the metros.
Will this be the way Max grows in the future? Like you'll be focused largely in metro cities in the north and west of the country, or are you looking at a geographical expansion beyond that, maybe to the south and east in a big way?
No, absolutely. So we are looking at both a geographical expansion. What we are also looking at doing is tier 2 cities. Places like Dehradun and Mohali are excellent examples in our portfolio, which are perhaps the highest return on capital businesses, again, doing very, very well. What we don't want to do and what we want to stay away from essentially is doing greenfields and doing projects in non-metros in other places. We are tying up with developers and REITs to be for build-to-suit hospitals. Because every city, every state has its own building codes, and I believe a lot of hospital chains in the past have perhaps miscalculated both the potential for time and cost overruns. So that is something that we sort of want to stay away from. But we want to tie up with people whose core competence is to build in these places. So we are looking at geographical expansion through that. But what we do like is a cluster approach. We would like to add to the clusters we already present in. But any new place we enter, we would like to do through a cluster rather than a single standalone hospital.